Right now, the Better Business Bureau is warning those enrolling in Medicare to be on the lookout for scammers during the special enrollment period. Most of these scammers might pretend to be a government representative who might be offering help walking you through the process. And in the process, they steal your information instead. Watch out for these and call the Better Business Bureau if you are the victim of this type of scam. These things pop up now because the government has opened Medicare.gov from October 15th to December 7th because the pandemic left so many Americans unemployed and uninsured. Here to talk more about this is the lead advisor at Chapter, Ari Parker. Ari, thanks for being here. So what's the number one thing people need to know about this special enrollment period? Has anything changed?
Well, the important thing to know about the annual enrollment period is that it ends December 7th. Right now is the opportunity you have in which to confirm your coverage for 2022. That means confirming that your doctors are in network, that your prescriptions are covered, and that your plan will operate as you anticipate for next year.
What are the biggest pitfalls from year to year with this enrollment period? What do people typically overlook?
90% of people will not do a comparison of their coverage to what they can to how they can expect their coverage to operate for next year. So just by virtue of putting together your list of doctors, your list of prescriptions, and considering the factors that are important to you, you're able to confirm that your coverage will operate as you expect for 2022. So the pitfall is doing nothing.
Okay. What about the costs? Are there any costs that people will incur or may see differently than in years past?
Well, in Charlotte, there are many $0 premium plans, and a number of these have actually changed for 2022. So just because you were on a plan for 2021, don't expect that it'll have the same exact costs as for 2022.
What about for people that are new to Medicare? You know, every year we add a whole new sector of people that may not be familiar with it, and there's always a learning curve because there is to everything. So what would you tell those people if this is their first time navigating the system?
The thing to know about Medicare by way of turning 65 is that it's not automatic. It's something that you affirmatively opt into. It takes less than 5 minutes in order to do. You can do it online through the Social Security website, ssa.gov, but it is something that you need to enroll in if you want your Medicare to start when you turn 65.
All right. One last question. When it comes to Medicare, we hear often the term supplemental. Do you need a supplemental, or is that just something that's extra?
It's extra, and it's wise to choose a supplemental, be it a Medicare Supplement, also known as Medigap, or a Medicare Advantage plan. The reason it's wise is because Medicare doesn't cap your out-of-pocket exposure, and it doesn't cover all of your medical costs. It also doesn't offer additional benefits like prescription, dental, hearing, or vision.
All right, Ari Parker with Chapter. That's good information. And it's good information for people to know and to realize that just going on Medicare does not cover everything. You still need to be very proactive. Ari, thanks very much for talking about this. We appreciate it.
Of course. Thank you for having me, Bill.
You bet.